people make when they take blood pressure. Okay, so it's important for your patient to have their feet flat on the floor and their arm at heart level. So it's advisable to keep it up on a table, which will be easier for you to take the blood pressure. And it's important to ask the patient if they have exercised within the last 30 minutes, drink alcohol or caffeine, to make sure that they haven't done anything prior that elevated their blood pressure. So, have you drank caffeine or exercised or smoked within the last 30 minutes?
No.
Okay. I'm going to go ahead and take her blood pressure. So, it's important to make sure that her arm is within 80% of the bladder circumference. Okay. So, as you can see, it is within 80%. So I will go ahead and make sure the artery goes in the inner part of her arm to make sure it's where the brachial artery is. So it's lined up with the brachial artery. Make sure the cuff is not too tight on the patient's arm and there's enough space for 2 fingers and that it is well above the elbow crease, about 2 finger lengths above the elbow crease. Okay, I'm going to go ahead and find her pulse and try to find her point of maximal inflation, aka the point of obliteration. Okay, so I found her pulse. Okay, so her point of obliteration is 120. So I'm going to go ahead and inflate to 140 or 150. Okay, so I'm going to place the stethoscope on her brachial artery, where her brachial artery is located. Okay, and I'm going to inflate to 140 or 150. Okay, so the first thump that you hear should be the systolic pressure, and the last thump that you should hear is the diastolic pressure. And as you determine the systolic and the diastolic, we should make sure that we don't release the air too fast so we don't miss the first beat and the last beat. And once you hear the last diastolic pressure, make sure to go under 20 mmHgs more, just to make sure that you don't hear another beat. Okay, so I got her blood pressure and it was 110 mmHg over 90 mmHg. And we should also record that it was her right arm and that she was sitting. Okay. So now I'm just going to go over the common mistakes that people make when taking blood pressure. So it's either when you're taking or determining the bladder, determining whether if the cuff is the right size for the patient, you always need to make sure that it's 80% of the bladder width. Sometimes if the cuff is too small or too big on the patient, it can alter the blood pressure readings. As well as if the patient has taken any caffeine or exercise within the last 30 minutes, it skews the blood pressure readings. So you should always ask beforehand if they have taken caffeine or exercise within the last 30 minutes of taking the blood pressure, and to wait until then to take the blood pressure afterwards. Another mistake that people commonly make when taking blood pressure is when they're determining and releasing the air to determine their systolic and diastolic pressure. People often release the air too quickly, which is a problem because you can't accurately measure when you hear the first beat and the last beat. And also the fact that when you determine the diastolic pressure, it's important to go at least 20 mmHgs below the last heard beat to make sure that you don't hear another offbeat, or to make sure that you have a more accurate measure of your diastolic pressure. Also, it is important to note that the arm is at heart level, and that is it.